but we're kicking off today's show with a story you've been hearing in our news bulletins throughout the course of the morning. And there are currently no one working in nursing or general support in either of Clare's Children's Disability Network teams. New data which has come to light at the latest meeting of the HC Regional Health Forum Midwest revealed significant recruitment issues in both of the county's CDNTs, with the East Clare team having a vacancy rate of 20%. To discuss this further, I was joined in studio earlier by Clare mother Kate Finn. Kate, good morning to you. Thanks for joining me in studio.
Good morning, Alan.
Can you tell us a little bit first about your family and your experience of accessing disability services for your child?
My son is currently 13. We were actually in America for the first nearly 8 years of his life. So we're back in Ireland now 6 years, and I guess have the experience of both services to compare. So, we've spent the last 6 years trying to get established here in terms of getting services for our son. And it's not just services, it's not just therapeutic services, it's getting appropriate medical care, dental care, respite, school stuff. So, there's a lot to it, not just therapeutic services.
Okay, yeah, no, it sounds like that there is quite a lot. And what do you make of these latest figures showing significant vacancies within Clare's Children's Disability Network teams?
It actually feels overwhelming and unfixable at times, because if you look at the East Clare figures that they've given, that there's 20% vacancy rate and a further 19% of staff are on leave. I never really fully understand how to interpret these things, but does that mean that almost 2 out of every 5 positions are unavailable to service at the moment? These missing roles really matter, because the whole model of CDNT is that they function as a team. And when key professionals are missing, families then, of course, question how comprehensive the service is. And then, of course, there's that fact in there that neither of the Clare teams have any nursing staff. And those roles are absolutely key, especially for children who are medically fragile and have very complex needs, not just therapeutic needs, but medical needs. So then you have so many parents who have nobody to help them coordinate a very complex system and to make calls on your behalf and advocate. And that must be just so hard for people to be without.
And can you give us a bit of insight, Kate, into when a lack of available services has had a direct impact on your child or family, or have you experienced the delays in assessments, the therapies or supports as a result of staffing challenges?
Well, I suppose the biggest shock to me was that in Ireland, these therapeutic services, so speech therapy, physical therapy, occupational therapy, are under a medical model, meaning the HSE provides them. Our experience in America was the opposite, in that those therapists are in the school system. And my son had access to those 3 services every day in our local school, because those services aren't always based on medical needs. They're more about the child's development and helping them communicate or navigate a school or sit at a desk, those types of things. So that was the biggest shock to me when we came back. And it took me a very long time to get my head around the fact that my son would not have one-on-one with speech therapists or any of the other providers. And that is the model in Ireland. It's that they will meet the teacher. If we take a speech therapist, for example, they'll meet the teacher. They might not even necessarily observe the child or spend any time with the child. They'll just hear what the teacher has to say, if it's a special needs school. And they might hear what the parents have to say. And then they'll do up a report making suggestions and hand it to the parents, effectively, or to the teachers who are already overburdened.
And how much pressure then does that place on, you mentioned teachers as well, but parents like yourself who are trying to fill the gaps yourself?
Well, Alan, when I became a mother, I thought I would just be bathing him and feeding him and loving him. I didn't realise that I would have to take on this role as a speech therapist. Not, I'm exaggerating saying I'm a therapist, but I do have to have a knowledge of how he communicates and how to help him. And, the reality is I know he hasn't had as much physical therapy as he should have had. And then you're always looking for opportunities to help him build strength or whatever it is. Occupational therapy, that is so desperately needed. And it took me years to even realise all that an occupational therapist can help you with. And that's probably an area I fall down on. It just puts so much pressure on you to always be thinking, what can I do to help my child express himself or, regulate himself or whatever your child's needs are. And it is far beyond, I think, the energies of an average parent.
Kate, I suppose, one alternative that might come to mind is private services, and I'm sure there are some families who've reached a point where they feel they've no choice but to seek private services, perhaps even yourselves, but I guess then that brings in the issue of affordability. Yeah.
Firstly, the private services are so desperately needed that they too have very long wait lists. And our kids, we don't need just a block of 6 weeks of speech therapy. Really, if we're all doing the right thing, they should just have speech therapy for years, indefinitely. And there's no family that can possibly afford that. And then, you have all the other things that go on with having young kids. So I think if a parent was to get private therapies, they know it's for a limited time. So they still have to live with the guilt or frustration of that.
The HSE says recruitment and retention remain major challenges. Do parents like yourself feel enough has been done to address the problem?
I think probably not. In my experience, not enough is being done. Do I have the answers? No. If I did, I'd be employed there. But I just think it's just rolled out as an excuse. And I do know, because I do my best to keep informed in this stuff. I do know that the HSE has a very cumbersome recruitment process. So you just wonder, do they lose people that, they could have gotten faster, or they moved on because the process was too slow? And also for therapists who are trained in other countries, coming back here and getting their credentials here or whatever is so cumbersome that you just think these are the things that need to be looked at to make it easier.
Just finally, Kate, what do you feel are the most urgent changes that are required to ensure children like your son receive the supports that they're entitled to?
Oh my God, I don't know, Ellen. Urgent. There are so many things. It's hard to pin it down. We're talking about CDNT here, but for some families, respite would be enormous for them. And that's another very small... there's just too little for the need. So it depends. For me, it would be respite. For me, my child right now, it would be planning for his future. And I know there is no planning for his future in terms of coordinating with a governmental agency, and that it's going to be for me to forge something for him.
Well, look, we do hope things change sooner rather than later. Kate, Finn, thank you very much for joining us on the show. And joining me now for more on this is Shirley Conway, who's on the line. Shirley, good morning to you.
Good morning, Alan. How are you?
Very well. Thanks very much for being with us. Shirley, you're very familiar with the CDNT, the Children's Disability Network Team Services, through your twin boys, Joe and Charlie.
Yes, that's correct, Alan. Yes, I am. And it's a very hard road, I suppose, Alan. No more than what Kate was saying there. It's very hard to get the services for our children, to get the therapies. It's kind of soul destroying, really. And I suppose I was looking in the sense that I paid for my boys' assessments privately, and that way then they were able to go into an early intervention preschool. And that's crucial for children, autistic children, it's all, they learn so much, and, they can be brought on so much. But that's not possible for everyone, and kids need all the help when they are younger, just in order to reach their potential for when they do start school and things like that, And I suppose when a child isn't meeting their milestones, parents need support and guidance. And I suppose that's not there for the parents, Alan.
And as you say, you had to go down the private services route, which is something I asked Kate about as well. And you both acknowledged that's not an option for everyone. Even in your situation, Shirley, if you're able to do it, is it a question of how long you're able to do it for before the costs become too onerous?
Well, that's the thing, Alan, and both my boys, they'd be very different profiles when it comes to autism. You have different profiles of children and their needs are all different and things like that. And I suppose for one of our boys, he's still at the moment, he's non-verbal. And I suppose we were paying privately for him. But you see, he had an awful lot of kind of medical complex needs. And I suppose they're only starting to be addressed now when he's 4, almost 5. So that was kind of getting in the way of him progressing. So you're paying out, and it's no problem, people do it, Alan, parents will do what they can for their child, But I suppose when there's other things going on and you're paying for a therapy that's not benefiting your child, they're not getting benefit out of it, it's kind of like a waste of money. But I suppose you're just doing what you can for your child because you're in such dire straits. You think, I want my child to have everything and, to come on. And it's just very hard, Ellen, and I suppose then you have your public and your private. Private, the waiting lists are shocking anyway for private services, for speech and language, OT, for everything. And it's just a really hard one, Ellen. It's really hard for parents. And I suppose it's hard, you're looking at your child and they're not progressing as they should be, with, say, a child of their own age, and that's very hard to see as well for parents.
And in a situation where, you may potentially, or others who have had to go through private services, reach a point where, and as you say, and as Kate touched on earlier on, so many people have gone down that route that the waiting lists have become quite lengthy. But if it reaches a point where you can't pursue it any further, and mainly maybe because of cost, and you look at going back down the public route, and you hear the story that is running in our news bulletins that no one currently working in nursing or general support in either of the CDNTs in Clare. What did you make of what you heard? What on a scale of 1 to 10, how surprised were you?
Well, to be honest, I wasn't a bit surprised. What actually did surprise me was reading that report that they said there was no nurse. But I never even knew there was to be a nurse attached to CDNT. And one of my little boys in particular would have benefited from that. And I understand, and it's not their fault either, right? This is a HSE run thing. My background is nursing. I worked in the HSE for many years. I understand exactly, about the public services and the public sector and what it's like. And it's not these people's fault, but it's very, very frustrating for families when they can't get what they need for their children, and you're going from Billy to Jack, and we'll make a note of it, we'll pass it on at the next meeting, and then you hear nothing. And that's really frustrating, and who is to blame at the end of the day? We're not trying to blame, the people in CDNT, they're doing what they can for the children in the area, but there's only so much they can do. And that's where it becomes really frustrating, and, you just don't know what to do for your children.
Recruitment and retention, they're still significant challenges, so says the HSE. Earlier on, Kate suggested that perhaps the recruitment process is cumbersome. In your experience, do you feel that is the case? And is that an issue?
Well, I suppose it is. And I suppose, what are they actually doing to kind of, entice the professionals to come and work for them? What are they doing? I know, throughout the HSE, you have nurses on leave, you have people immigrating. A lot of these therapists are probably immigrating, and they are coming up along. But like they probably just want a better life for themselves, so they're not going to stay in Ireland. Do you know what I mean? They probably just want to go and work elsewhere. So then, we have no one here then to provide services for our children. And you can't blame them either, Alan, for wanting to emigrate, But it's just really hard. At the end of the day, it's affecting our children then because they just do not have the services,
It feels like something that we're going to be talking about again before too long, unfortunately, Shirley, unless something significant changes. What would you like decision makers in both the HSE and in the government to understand about the reality facing families in Clare, and what needs to be done or to be changed in order for their situations and their children's situations to become better?
Well, really, the whole thing has to be looked at, and they have to try and recruit, these health professionals. It should be made easier as well. Like, there's only a certain amount of, we'll say, early intervention preschools around. That should be looked at because they're vital for autistic children or children with special needs, because in the Malin you have, we'll say, 6 children to 3 staff, which is amazing. My own 2 boys go to it, and the difference in them is unbelievable. So more of that needs to be done. And like, I know there's an awful issue now. It's not affecting me at the moment, but I do know with regards to, you have CDNT and you have CAMS. So CAMS deals with like ADHD diagnosis and mental health. And there's a big kind of barrier there between the two. Where like you have a child in CDNT or a teenager, whatever, and they might be showing ADHD signs, but then CAMS does not want to take on that child because they're part of CDNT. So that should be something that's looked at as well. Because again, these parents are left in limbo. They can't get the proper help for their children. Just because they're autistic doesn't mean they can't have another diagnosis as well.
Okay, well, look, we do have to leave it there, but Shirley, we really appreciate your time on this, and look forward to speaking to you again soon, and hopefully on that occasion, situation for both your children and the likes of Kate's son and other parents out there with children in this situation will have improved. But for the moment, thanks very much for being with us.
No problem, Alan. Thanks for having me on. Take care.
Take care. Shirley Conway with us on Morning Focus on that. And if, like Kate and Shirley, your children, through your children, you've experience of the CDNT services, we would love to get your hear about your experiences, your story, and also your views on the fact there's currently no one working in nursing or general support in either of the CDNTs in this county. 0818 400 964 to give us a call or send a message our way via text or WhatsApp 086 1800 964.